The menopause occurs when women lose their female hormones. This occurs to every woman somewhere between the age of 40 and 50. 90% of women say that they have no education at all around the menopause, and 60 to 70% of women only start Googling or looking for information once they develop symptoms. Symptoms are varied, and these range from brain fog to anxiety to hot sweats and fatigue. We are finding that women not going for information early enough means that they're entering this time without adequate information or adequate treatment. A lot of women who do come for treatment are very worried about taking HRT, which is one of the many treatment options available. HRT replaces the hormones which have been lost. One of the reasons they're worried is because they think HRT may cause cancer. This isn't correct. It has a very, very, very low incidence of cancer. But a lot of women are concerned about this, particularly if they have a family history. We're now able to do the genetics on someone, and this will give us individualized personal risk. Genetic screening is a really exciting addition to the testing that we're able to do. Patients come in, they have a full physical examination. We make sure that we've checked their blood pressure, we've measured their cholesterol, and we have checked to make sure that they're overall in good health. We are now able to add on genetic screening. This enables us to assess their individual risk of cancers. For example, if a patient has a family history, if the mother has breast cancer and the grandma has ovarian cancer, that gives them a background risk of 15% for breast cancer. However, adding in HRT increases that risk by 0.25%, but that's just a generalized risk for the whole population. If we do someone's genetics, we can tell them whether they have inherited all those genes or none of their genes. And that would affect the screening that we would advise that they have. When you come for genetic screening, you have to give informed consent. This means before any screening takes place, you will speak to someone who will explain to you exactly what will happen and the implications of the testing. This is to make sure that you're aware that sometimes patients come in wanting to be screened for breast cancer risk, but when the screening comes back, it gives a result relating to something different. And patients need to be made aware in advance that sometimes results come back which we're not expecting. Once you have given informed consent, we will then take the test, which is either a mouth swab or a blood test, and then that goes off for analysis. It takes about 4 weeks to get the results back, and once they're back, you will have a follow-up appointment via Zoom with Dr. Angela George, who will be able to give you the results and interpret them. But everybody goes through menopause. Some women are lucky and they have less symptoms than others, although the research is showing that 70 to 80% of women do have significant symptoms. The treatment for menopause is individualized. So some women decide they don't really want any treatment at all. About 25% of women look at alternative treatments, such as herbal treatments, and a percentage of women come forward for HRT. Genetic testing isn't painful. It's either a mouth swab or a blood test. It takes a minute or so to do. There is no danger involved in doing a genetic test. the important part is to make sure that you're giving informed consent so that you're emotionally prepared for a result you may not be expecting.